Hello, my name is Dr. Julie Orlowski, and I'm one of the family physicians with Cornerstone Care at our Burgettstown location. I wanted to take a moment today to come to you and talk about breast cancer. October is Breast Cancer Awareness Month, and this is a time for us to honor the survivors, remember our loved ones, and educate ourselves. Early detection is key in fighting this disease. 1 in every 8 women will hear those frightening words in their lifetime, "You have breast cancer." To put this into perspective, in this year they estimate that 310,000 women will be diagnosed with breast cancer in our country, and 2,800 men. And that's something very important that I want to point out. Men can get breast cancer too. So it's very important for us to know what is normal in our body, and if something abnormal happens, to have a family doctor that you can come and talk to. Self-breast awareness is a long term that mainly means knowing your body. You know your body better than any doctor does, and that's why it's so important that if you notice anything new, something concerning pop up, you come and talk with us. So I want to explain what this means though. So we used to, many years ago, teach people how to do self-breast exams. But I think this was somewhat intimidating for people because they were quite detailed, and if you went to different organization websites, the American Cancer Society, the United States Task Force, they all had different ways of doing it. And so again, somewhat intimidating. And now we don't recommend that you have to do it in this proper way or follow it with any set of directions. It's just feeling your breasts and knowing what is normal. And remember, when you feel your breasts, feel up into your armpits because the breast tissue does extend there and cancer can form there. If you felt a lump or a bump, you would want to come and let your family doctor know. It's also very important not just to feel your breasts, to feel for lumps or bumps, but also to look at your breast in the mirror. And if you happen to notice a new skin rash appear or dimpling of the skin, changes to the contour of your breast, or even changes to the nipple, such as an inverted nipple, those can be concerning signs that something could be happening within the breast tissue. And that's when we would want you to come and talk with your family doctor about that. So for most women at average risk, starting at age 40 is what is currently recommended. Now, there are some patients that have a higher risk of breast cancer. Maybe they have a family history of it, or they have a gene mutation, such as the BRCA gene. Those patients may be starting their mammograms in their 30s or maybe even in their 20s. So if you're higher risk at that point, talk with your family doctor, and then we can come up with a good time frame for you based on your family history. Now, I do want to point out there are many risk factors for breast cancer besides just family history. We can't control our family history, and we can't control our age. You know, breast cancer risk does go up as we age. We can't control those, but we can control many other risk factors associated with it. The first one I want to point out is being active. You know, we know that if you have a sedentary lifestyle, you're overweight or obese, that's going to raise your risk. So staying active and making sure that your diet is a clean diet and it doesn't have any processed foods or refined foods or sugary foods. Those are things that can raise your risk as well. Another risk factor to point out is alcohol. It's important to cut back or eliminate alcohol, as we know that that is a risk factor. But each of these things that I mentioned are things that you can control, and they also will give your family doctor more information so that we know when would be appropriate to start screening for you. So most of the big organizations, like I mentioned earlier, most specifically the American Cancer Society, says most women can stop around age 75. However, that's a discussion that you can have with your family doctor too, because I have many patients that are 75 who are still very active, they're very healthy, they may live another 10, 15, even 20 years. So I wouldn't stop. I had mentioned earlier that age is a risk factor. The older we get, the higher our risk of breast cancer. So if you're a 75-year-old woman and you're in great health, and we anticipate you have many more healthy years in front of you, I would not stop. I would say let's keep screening every year. Just to recap, the 3 things that we've talked about that I really want to emphasize is breast self-awareness, early detection, and improving your lifestyle. Together, we can fight this disease. Our love, commitment, and support goes out to all breast cancer survivors and fighters, not just this month in October, but always. Thank you so much for your time.